some rapport where we don't revisit some trauma that they've suffered. So I'm real proud of the work we're doing. I think this goes without saying that the best outcomes we have are when people have access to resources, family, services. And we see all up and down the chain. I have people that have family that have private health insurance, can get them connected to all sorts of services, to the other side of the scale, to the very indigent that don't have any family and are frankly living on the streets. And those are hard cases. They're just difficult. And lastly, I'll stress this, and I think this was touched on by a previous speaker, but there is no silver bullet. It's not a law enforcement problem. It involves public health. It involves treatment. It does involve law enforcement. It involves the court. And hopefully getting the goodwill of the public to see that we all need to work on this. But it can't be just one person's issue. It has to be all of us. But thank you for being here. I see a number of legislators here. I appreciate you being here. Thank you.
Thank you to each one of our panelists. We've got about 5 minutes because we do want to get to our next speaker because I know you want to hear him speak. So if we do, in the short amount of time we do, if we have any questions, we have 2 microphones on each side of the room. Does anybody have any questions for any of our panelists? Yes, ma'am.
I have a question. Can you hear me? I have a question for the judge. Yes. You mentioned that some of your clients have stigma. They don't necessarily want to admit they have a mental illness. They would prefer that to say that they'd rather be, that they have a substance abuse problem instead. Are you aware that a lot of times people with severe mental illness, it's because of a brain problem? It's called anosognosia, and they really don't believe they have an illness. So do you deal with that sometimes?
I can't say that I do. I use that sort of more of as an example that the person I'm thinking about, mm-hmm. I think they were doing that intentionally. At least that's my own observation, mm-hmm. because of some family reasons, mm-hmm. that it was easier to tell their family they had trouble with alcohol or drugs than it is to tell them they had a problem with mental illness. I think that stigma attached to that family, that pressure of having to tell their family members, that was greater. But I appreciate your observation, though, and I did not know that.
And the other question is sort of to everyone, not just to the panel, and all of your speeches were incredible, or your presentations. But there has been the most incredible act that was just signed into Congress and passed into law under the 21st Century Act in December, which will provide funding to states like Alabama for law enforcement, for CIT training, for early intervention, as well as assistive outpatient treatment, which is AOT. I have heard nothing about that today, so could anyone address that?
If you want to do it. We'll come on up.
It just looks good. Thank you for bringing that up. It's incredibly pivotal legislation that took its time wandering through the legislature, the federal legislature, but with the support, bipartisan support, and signed into law by Mr. Obama, that's going to hopefully truly move us into the 21st century, that will provide funding. The logistics of the bill in terms of how money is going to flow, I'm not yet aware of. I'm kind of waiting for it for direction. But I think it has the potential for offering considerable funding for specialized treatment, for assisted outpatient treatment, which is, in essence, outpatient commitment. There is some controversy about that. I actually think assisted outpatient treatment is a good thing, but I'm not a consumer and I haven't experienced it, but I think it is helpful, particularly for people who, with mental illness, who don't believe they have a mental illness. You experienced that for several years, and it is profoundly influential on someone's treatment course. But I think it's a major bill to have been passed by the federal government, and I'm hopeful that as time progresses, we're going to hear much more about it and the logistics of how we can access that expertise and that money. It does create an office for a medical director and an administrative director in SAMHSA, which is really important that we're going to have a psychiatrist in mental health actively involved and engaged in providing that kind of leadership.
Dr. Feldman, if you
We have
would,
time for one last
I've
question.
got one quick question for you. In your comments, you made reference to the fact that mental illness is a biologic disorder.
Yes.
We've had several speakers today, and all of the speakers have been wonderful, but we've had several who have referred to behavioral health.
Right.
How do we change the dialogue so people will talk about the fact that it is mental illness, that is mental health. It is not behavioral. You know, you don't choose to be ill.
Right.
You don't choose to do the things that you do. How do we change that paradigm?
Well, I think by asking that question and by each time we talk about mental health issues or substance use issues, that we either preface it or as an afterthought say, and remember, these are biologic illnesses. I think, Graham, you bring up an important point. My concern about using the term behavioral health is that people say, well, then people can make choices. They can change their behavior. Someone who is floridly psychotic, somebody who's in the midst of a terrible addiction, I'm telling you, people don't choose to be in those places. Nobody would choose to have to suffer from these illnesses. So I refer to the term as mental health, but I also refer to consumers as patients. But that's just how I'm built. I think it's important we always underscore the theme that these are biologic illnesses that need treatment, that respond to treatment, that need wraparound services. It may not just be a pill. They may need to have a case manager or an ACT team or supported housing or supported employment. So we have to understand we need huge wraparound services to help people get back into recovery.
Thank you. And with that, let's get our total round of applause for the panel right here. So. At this point, Graham Champion is going to introduce our next speaker and final speaker for the day.
Thank you, Paul. Our final speaker of the day is a gentleman that my wife and I met probably 12, 13 years ago at a NAMI national meeting. And he was presenting on a book, I guess, that is truly his signature book, Crazy, A Father's Navigation Through the Mental Health System. And for those of us who are parents or family members of someone living with a mental illness, we understand the passion, we understand what you do. And what Pete Earley has done, you've got his bio, and I'm not going to go into a whole lot of that, but I can tell you the book that he wrote, the story that he told, the time that he spent with Judge Leifman in Miami-Dade County, learning about what was going on in the jail down there, and living with a son who had experienced a lot of these things himself in Northern Virginia. The book was a labor of passion. It tells a story, and it points to the man who is an investigative reporter by training, but a man who is absolutely committed to what is right in the mental health field. We're blessed to have Pete Earley to wrap this thing up for us today. Pete?
Thank you so much. That was great. Thank you. Wow, what a day. I want to thank Wanda, and I want to thank Jimmy. Thank you very much for inviting me. When I was a Washington Post reporter, I refused to participate and join in any groups because I wanted to be objective. First thing I did after I wrote my book is I joined NAMI because I needed it. So thank you, NAMI. I also want to say thank you, Commissioner Perdue. I do a lot of these, and usually the commissioner runs in 5 minutes, tells you everything he's doing great, and dashes out that door with the legislators all behind him because they don't want to stick around. So thank you very much for being here. I want to thank CIT And I want to thank, in particular, the Alabama Disabilities Advocacy Program for suing your state. Sometimes that's the only way to make any progress. And now I have a complaint. You put me after Steve Leifman and all these speakers, and every one of them has said something I wanted to tell you. So this is kind of a remedial repeat here in some ways. But first, I want to tell you that the problems you're facing here in Alabama are not unique, and that's a national shame. A year ago, 24-year-old African-American Jamil Mitchell gets arrested. He gets put in a jail in Hampton Roads, Virginia. The judge says, oh, well, we need to go get him competent. They find the paperwork 6 days after he is found dead in his cell, covered with feces. He was in that cell 101 days. He died of a heart attack that was caused by starvation, even though he was under 24-hour suicide watch. And an investigation has raised questions about whether officers dragged, sprayed him with mace, beat him in jail, verbally abused, get emotional, laughed at, stood on him, treated him like an animal because he would not follow their rules. He was arrested for taking $5.05 worth of snacks, a Mountain Dew, a Snickers bar, and a zebra cake. He's typical of the prisoners who I want to talk to you about today. We're not talking about Hannibal Lecter serial killers. We're talking about people with serious mental illnesses whose only real crime is that they got sick. Now, I've been asked to tell my family story, to put a face on jails and prisons and mental illness. So my story begins like a lot of stories begin with a phone call. Here's my son. He was at the Pratt Institute in Brooklyn studying art. We talked every Sunday. I live right outside of Washington, D.C. And he said to me, he said, Dad, food doesn't taste good. I've stopped eating. And I went, well, tell me about it. No, I don't want to talk to you. Never mind. He called back an hour later and he said, Dad, I think I got up this morning and I took 5 homeless men to breakfast.